She gave me sinulong-tong today. And here is the beauty. I don't want to take it. But she would get mad. She would get mad at me. And I'm tired of getting into argument. I just want my arthritis gone. Okay? And the doctor said, oh, I see. How high is your uric acid? When was the blood test done? And the patient said, no, doctor. My wife said it is high because I have arthritis. Let's go to case number 2. Doctor, I have arthritis on my right knee. I have uric acid. So I said to myself, of course, everybody has uric acid. My wife told me to take medicine for uric acid, but I never got better. She also let me take herbal medicines and advised me to eat more before taking the medicines. Parang natugo kayo na inyong kabulong. Then I said, your weight is 203 pounds and is quite heavy for a 5 feet 2 inches person. Ano po siya? 203 pounds siya. So, just being polite, and we can say, hey man, you are obese, so you're quite heavy. Your uric acid is normal. Nagpakuha na sila. You need to have an x-ray of your right knee. And the patient said, I will ask my wife, doctor. Last case. Grabe. Doctor. And she said, and he said, doctor, I have pain on the right shoulder. My wife brought me to the hilot as advised by her mother. After 4 hours, doctor, I am in severe pain. My mother-in-law said that my uric acid has something to do with it. Okay? So I said, oh, I see. Is your mother-in-law a doctor? And the patient said, no, doctor. She works as manok hilot. And I said, boy, oh boy, you are not her favorite son-in-law. So, this message, truly, truly, I say unto you, arthritis is not uric acid. Okay? So, bear that in mind. Arthritis ka. Uric acid. No. There are so many. Remember. And gout is just one of the 200. So, truly, truly, I say unto you, arthritis is not uric acid. So, let's define. What is arthritis? It is pain and swelling of the joint. It is an inflammation of the joint. It can be a disease of the joint per se, or it can be related to a particular condition. What the Bible says, the Lord will strike you, Deuteronomy chapter 28, verse 22, the Lord will strike you with consumption, that is muscle wasting, with fever, with inflammation, with severe burning fever, with a sword, with scorching, and with mildew, and they pursue you until you perish. Psalm chapter 38, verse 7, for my loins are full of inflammation, and there is no soundness in my flesh. So meaning, ang inflammation niya, biblical na siya, halip pa niya sa muna, may inflammation niya. So, arthritis, by definition, understand, may arthritis ka, kabalog ang imo nga joint. important signs that you will look. Number one, you have pain. By the way, it was discovered or observed by Eulus Cornelius Celsus. He is a Roman physician and encyclopedist. He must be very, very brilliant, you know. And the batch siya ni Hippocrates. Okay? So he was born, I think, 25 BC and died 50 AD. So more or less 75 years old. So going back to the cardinal signs, you have redness, swelling, heat, loss of function. So you have here pain, you have heat, init, kapula, gabanog, and then magiho. Okay? So kung nagpapunta in a drawing, so this is the normal joint, and this is the arthritic joint. Look, there is significant inflammation. So, the next slide, we're going to talk about gout, your favorite, everybody's favorite. So, imagine, the devil is biting your big toe. How painful is that? Hindi ko ganito makabulan. And then you know somebody here who has gout, and he goes to the ATM's office. He is my ihado. So he's like that, no? So let's look at the history. It is the oldest known type of arthritis, discovered 5th century BC, and recognized by Hippocrates. It is the disease of kings due to its association to good food and alcohol consumption. And let me tell you the notable figures suffering with gout or gouty arthritis. So we have here Christopher Columbus, King Henry VIII, Benjamin Franklin, Beethoven, Napoleon Bonaparte, and last but not the least, Pastor Harry Vincent Anople. Okay, so another one, Maulin Ronsales Maihado. Notable figures with gout. They eat rich food even without alcohol consumption. Okay? Pastor Harry, joke lang na. But it's good that you're a notable figure. You belong to the kings. Okay. So next. So what are the signs and symptoms of gout? Look at that. Those are the signs of inflammation. Intense joint pain, the patient can walk, redness, heat, swelling, and most of the first attack is the first symptom. But it can attack also other joints. Okay? So the risk factors. Well, we know the diet has something to do with it. But the major part is, of course, the family history of gout. If your father has it, that is always a 50% chance of having it. If your mother has gout, that is always a 50% of having it. Both parents has it. More likely the percentage increase. I would like to thank my QPH classmates are here. So, overweight, as I said, because it produces more uric acid. And kidneys tend to have more difficult time eliminating it. So medical condition, like it's mentioned by Dr. Olga, says men are frequently affected by gout. However, women can have gout too, especially gouty attack, and even recent vaccination. If you're taking certain medications such as aspirin, diuretic, beta blockers, or even anti-TB drugs, it can trigger a gouty attack. Next, how is it diagnosed? Of course, you have the physical exam, you check the patient, you evaluate the symptom, you do the synovial fluid analysis. You get the blood test of the uric acid, and at times you get X-ray, no? Para makita mo ang soft tissue swelling, if there is already joint erosions or not, you can find that in X-ray. So what do I do in the clinic? I do this. I do knee joint aspiration. Nakakaalam natin ang tuhod. So, if you divide the knee, when you divide the knee, sa synovial bag sa sulod ng lobo na, no? So, this is the inner part, and this is the outer part. So, this one, you puncture the needle on the outer side, the outer part, and you aspirate. And then you look it under the microscope. Ang mali ang tsura sa monosodium urate crystal. So, when I was in University of Santo Tomas, ang mali black to sa amin sa synovial fluid. So, it is a negatively birefringent crystal. Katahong sa ito mo. Katahong kasi ikaw, I learned a lot of this. Katahong sa iya, there is a polarizing microscope that I use. At the stage, you turn it like 90 degrees left and right. You will know that it is monosodium urate because if you turn the stage 90 degrees, the blue crystal will turn into yellow. So that's the beauty of polarizing microscope. So what are the stages of gout? First, stage 1, tataas-taas mo ng uric acid, tapos hindi ko pa nag-atake, no? Next is stage 2, nag-atake again. Bumanong ng iyong joint sa kamalang ko, sa kilay mo. And then, naayo ka. And then, stage 3, atake for a long period of time. And then, after 2 years, tinatake ka naman ulit. And then, it becomes frequent, like 3 to 4 times a year. And that is what we term as chronic gout. Pabalik-balik, pabalik-balik. So, kung hindi siya magulo, may konsekwensya sa salat sa pag-indiunan. Okay? May konsekwensya na. So this is the consequential damage due to gout. Pwede ang uric acid mag-deposito sa mata, pwede siya makakos heart disease, pwede siya makakos secondary osteoarthritis, pwede man siya makadiposito sa talungkan, sa kidney, at sa joint. Let me show you. So, very high uric acid, no? Para sa talungkan ng deposito. Next, para sa mata, pwede sa eyelid sa mata mo. And then, even sa sulod, sa iyong retina. This one, puti-puti na hindi, ang unang deposits of uric acid crystals. Or, pwede man na ang ining sa siko, primero ng panog lang, eventually, mayroon siya lumato. No? So, it can get worse. Hindi na maamo na. You know, I have seen cases like